Hey everyone, good day to all. Myself Dr. AJ Moria. Today I'm going to guys cover all the important culture medias. Okay, na? So guys, I'm expecting one MCQ from this slide. Okay, now just please try to listen very carefully. Within 10 minutes, guys, you will get one MCQ. Okay, now please. Okay. So guys, I am also conducting the quizzes and the daily discussion, topic discussions, subject wise, in the Telegram group, which is the Fmge aspirants, Dr. AJ. Just try to search in the Telegram Fmge aspirants, Dr. AJ Moria, or also you can. I will provide the link in the description, and also you will get this PDF in the group only. Okay, the link in the description. Okay. So guys, let's remember this one. First one is the TB. First one is the TB. For the TB, the culture media is the Lowenstein Jensen media. Okay, this is a LJ media. It is a LJ media. Okay, LJ media for the TB. Okay, now TB. What is the stain? Stain for tuberculosis is the JN. Nil. Nil stain. Okay, Jane stain. Guys, sometimes they may ask. They are going to ask the questions like this one or okay, na, for the acid fast bacilli in the Jaden staining. What is the primary stain? It is a carbol fixin. The carbol fixin. What is the decolorizer we have to use? It is the 20% hydrogen sulfide. What a countercurrent stain? It is the methylene blue or malachite green or picric acid. Please remember this one. Okay, na? So next one is guys, Corynebacterium diphtheria. Corynebacterium diphtheria. Okay, now there is a pseudomembranes here. There is a pseudomembrane formation here. You can see here there is a bull's neck, and you can see in the mycobacterium in the mycobacterium diphtheria, guys. Okay, it is a comma shaped. I think everyone knows. Okay, everyone knows about this one. So, guys, for the corynebacterium, guys, the if you want to get the result earlier for a very early result, if you want to get the early result, guys, faster, you have to go with the Loeffler's serum slope. Loeffler's serum slope. You will get within 4 hours. It shows white colonies. Okay, na? And for the if you want the better result, the best one will be with the potassium tellurate blood agar. Potassium tellurate blood agar. Okay, now it forms the black colonies. Okay, the result will come after 48 hours. Okay, now corynebacterium two times two things. For the early result, it is a Loeffler's serum slope. Better result is the potassium tolerant. If they ask which is the best one, it is the potassium tellurate blood agar. The next one is the Salmonella typhi. For the Salmonella, guys, it is the Wilson and Blair. Wilson and Blair bismuth sulfate media. Okay, now it forms the jet black colonies from the jet black colonies. One thing you need to remember about the typhoid, guys, it is the remember the Basu. Remember the Basu. I think you don't know about this mnemonic Basu. So, guys, for the typhoid, for the diagnosis, in the first week, you have to do the blood culture. The second week, you have to do the agglutination test. Okay, now? Like this one, guys. Okay, now? Yes, serum. Stool test. Okay, now? Yes, stool test. U for urine culture. Okay, now? The first week, you have to do the blood culture. Okay, now? The second week, you have to do the agglutination test or Vidal test. S for stool culture, U for urine culture in the fourth week. Okay. Just remember the salmonella. Okay. Now, next one is the Vibrio cholera. This is very important, guys. For the Vibrio cholera, it is also called as it causes rice water stool. Rice water stool. Water stool, diarrhea. It increases the camp. Increase the camp. Okay. CMP camp. Okay. So it is shows darting motility. Darting motility. It is a comma shaped. Okay, comma shaped. What is the shape of the corynebacterium? It is the shape of what? It is a Chinese letter. Okay. Vibrio cholera, it is a comma shaped. Causes rice water stool. It is due to increase in the camp, CMP camp, and the culture media is the TCBS, thiosulfate citrate bile salt, sucrose. Okay, na this one. The next one is the Bacillus anthrax. This is the Bacillus anthrax. Culture media is the plate. Remember here, guys, you have to differentiate between the um, Bacillus anthrax and the scrub typhus. See here, guys, there is a black color scar formation. There is a black color scar formation plus history of cattle. History of cattle. Then you have to mark the Bacillus anthrax. If there is a scar formation and there is a mite, there is a history of bite of mite, then it's going to be what? It's going to be scruff typhus. Okay, scruff typhus. Okay, remember here, guys. Okay, now Bacillus anthrax. There is a scarf, black color scarf formation plus history of cattle. That is the Bacillus anthrax. As you know, the Bacillus anthrax is the box shaped. Okay, now it is the box shaped. Okay, appearance here. It is a, okay here history of cattle. Okay, now if there is a black color scar formation plus mite, it is the scruff typus. Okay, na? Done, done, done. That is anthrax is okay, na? Remember, guys, very, very important one. Okay, this is the next one is the Neisseria. This is the Neisseria meningitis gut. It is the mod modified Thayer-Martin media. The modified modified Thayer-Martin medium. Modified Thayer-Martin medium. Okay, na? How you are going to differentiate between the Neisseria meningitis and the Neisseria gonorrhea. Okay, na? See, guys, for the gonorrhea also, guys, the culture media is also same modified their Martin media only, but on the fermentation, guys, on the fermentation it is fermented on maltose plus glucose. See, remember here, guys, this is a C, it is a meningitis. C, M for maltose, G for glucose. Okay, na? Maltose plus glucose. What about gonorrhea? It is only glucose. Ferment on only glucose is the gonorrhea. Glucose only. Okay, na? Then this is the Campylobacterium and the Zygini and the Helicobacterium. This is the Scirrhos media. It is the Scirrhos media. Okay, now next one is the for the Staph aureus, guys. For the Staph aureus, it is the mannitol salt agar and a Ludlam's medium salt milk agar. Okay, na Ludlam's salt agar or the Ludlam's medium salt milk agar. Okay, na. So, guys, on nutrient agar, it produces the golden yellow colonies by the Staph aureus. Okay, na. For the strep pyogens, guys, this is the crystal violet blood agar. They are not going to give the directly as the like what is the culture media for the Staph aureus. No, they're not going to give like this one. They're going to give a case history, and then they're going to give the case. You have to diagnose the case, and you have to know that what bacteria is causing this disease. Suppose example, they are going to give the PSGN. You have to know. Okay, Staph aureus. Next one is the streptococcal step pyogens. Okay, na? These are the crystal violet blood agar. Crystal violet blood agar. Next one is the for the pneumococcus and the enterococcus. There is no selective culture media. Okay. Remember here, guys. You need to remember some transport media. Okay, na? Transport media. Okay, na? Because, guys, guys, suppose example you are posted, you are having posting in other villages, and your clinic, the PSC is very far. Okay, your lab is very far. So if you want to extract the blood, if you want to extract the fecus also, guys, if you want to take the fecus to the lab, it's going to be like lengthy process now. That's why you have to put those species in a media. Okay, that's why you have to until you reach the lab. Okay, na? That's why see here For the this is the carry blade transfer medium and the Venkatraman Ramakrishnan VR medium are used to transfer feces from the suspected cholera patient. Okay, the cholera patient is the VR Venkatramana Ramakrishna medium and a carry blade transfer medium for the cholera. Next is the SAT buffered glycerol saline used for the transfer feces from the patient suspected to suffer from the bacillary dysentery. C. SAT buffered buffered bacillary. Okay. Next with the Pikes media is my favorite one. The Pikes media used for transfer media for the streptococci from throat specimen. Okay, na? From the throat specimen. It is the Spikes media. Okay, na? Please don't remember, don't forget. This one already came in the exam. That's why I remember this one very much. Okay. I think this one. No, I think this one. No, you guys know about this one. Thayer Martin. I told. Remember this one, guys. Thayer Martin, guys, for the gonorrhea also also covers the what N gonorrhea and the meningitis also. Okay, na? It both covers the gonorrhea and the meningitis. It contains antibiotic called as VCN. Okay, it's a vancomycin, colistin, nystatin. Okay, na? Remember this. Remember this. I think everyone knows this one. No, everyone knows one. Okay, done, 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 done. See this one, guys. For the Shigella, okay. For the Clostridium, guys, it is the Robertson's Cook media. Okay, now for Shigella, it is the XLD xyloslicin disoxy disoxy desoxycholate agar. Okay, and also is a citrate agar and is a Salmonella Shigella agar for the Shigella. Okay. And also, guys, McConkie for the Enterobacteriaceae member contains bile salt that inhibit the most gram-positive bacteria here. There is a pseudocell agar, that is a cetrimide agar used for the aeruginosa. For the aeruginosa, it contains cetrimide and act as the antiseptic agent. Okay, na? I think everyone knows about this one. Don't forget this one. This is the I created the all the tabular form. Okay, na? All the tabular form. Okay, na? Out of these guys, remember the TB, meningitis, corynebacterium, clostridium important, anthrax is important, salmonella important, vibrio is important, campylobacter is important. That's right. Okay, na? So it's my guarantee that you will get one MCQ. You will get one MCQ from this 8 slides, from this 6 slides. Okay. Okay, done, 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 done. Please remember, please don't make any mistakes. Okay, na? So see you in the next video. Thank you very much.